Hello everyone, this is Mila. Today I'm reading Part 1, Before You Begin. Chapter 1, My Conversion. I was not sure how much more frustration I could bear over my wife's deterioration health. And I wasn't just another worried husband. I was a medical doctor. As a physician for more than 30 years, I was accustomed to have answer to medical questions. After graduating from the University of Colorado Medical School and doing postgraduate work at Mercy Hospital in San Diego, I settled into a successful family practice in a small town in western South Dakota. Along the way, I met and married Liz. She had some health problem, but Liz honestly thought that if she married a physician, her health would improve. Was she ever wrong? Before long, our family includes 3 children under the age of 4, and a busy Liz grew increasingly worried. Every mom with a little children is tired, but Liz seems unusual fatigue, although she was only 30 years old. She told me she felt 60. As the year passed, she developed more symptoms and health problems that required several medications. By our 10th anniversary, Liz was so tired that most of the time she labored to put on feet ahead of the others. She experienced continually total body pain, overwhelming fatigue, horrible allergy, and recurrent sinus and lungs infections. Finally, after testing and evaluation, Liz's doctors diagnosed her problem as a fibromyalgia. This medical condition involved a array of symptoms, the worst being chronic pain and fatigue. In past year, fibromyalgia was called psychosomatic rheumatism, and doctors believed the disease was all in patient's head. We have since learned that fibromyalgia is a true miserable disease, which I can vouch for after watching my wife suffering. Liz was willing to try anything so that she could continue the pursuit of her passion. Fatigue curtailed all work with her beloved animals. She became so severely tired that she was unable to stay up much beyond 8 p.m., and she struggled just to keep up with basic domestic chores. Since my fibromyalgia has no cure, all I could do to see Liz's symptom was load her up with medication. I had her taking amitriptyline at night for sleep, anti-inflammatories for pain, muscle relax and inhales for her asthma, and hay fevers, seldom for allergies, and eventually weekly allergies shots in spite of my efforts and all this medicine. Years after year, her health gradually worsened. In January of 1995, Liz and I concluded that more exercise would benefit us both. We had put on extra pounds and made a New Year's resolution to get back into shape. Liz tried hard but missed more workout than she made. One infection after another left her sick and on antibiotics more often than not. In March, she developed severe pneumonia. She labored to breathe as one lobe of her lung became completely filled with infection and closed off. The physician caring for her lungs was very concerned it may not heal and could possibly even require surgery and removal. We consult an infection disease specialist, and he placed Liz on intervals antibiotic, steroid, and nebulizer treatments. Fortunately, with 2 weeks, the pneumonia cleared. Her cough, however, persists, and she continued on heavy medication for a month. Of greater concern was her fatigue, which was now worse than ever. Liz was out of bed only about 2 hours a day. Her asthma and allergy were raging, and only with luck would she make the walk to the barns to see her horse. Liz was so sick the children took turns stay home from school to care for her. Consistently in bed, she felt too weak even to watch TV or read. This went on months after months. Although I maintained my professional exterior, on the inside I was growing desperately. I visited several times with the pulmonologist and the infection disease specialist. They assured me that with this diagnosis, they were doing everything possible. When I asked how long it would take for her to recover, the answer was 6 to 9 months, or maybe never. About this time, a friend of the family shared with Liz that her husband had also pneumonia and had experienced significant fatigue during the recovery. He took some nutritional supplements, and they had helped him regain his strength. Liz and her friends were aware of my negative attitude towards vitamin supplements, so Liz knew she would need my blessing before trying them. When she asked, even I was surprised at my response. Honey, you can try anything you want. We doctors certainly are not doing you any good. Presupposition put to the test. To be honest, I know next to nothing about nutrition or nutritional supplements. In medical school, I had not received any significant instruction on the subject. I was not alone. Only approximately 6% of graduating physicians in the United States have any training in nutrition. Medical students may take elective course on the topic, but a few actually do. As I mentioned in the introduction, the education of most physicians is disease-oriented with a heavy emphasis on pharmaceutical. We learn about drugs and why and when to use them. Because of the respect people have for doctors, they assume we are experts on all health-related issues, including nutritional and vitamins. Before my conversion experience with nutritional medicine, my patients frequently ask me if I believe their taking nutritional vitamins produce any health benefit. They brought their bottle of supplement into the office and let me look at them. I wrinkle my brows and with my most astute professional expression will carefully examine the labels. Handling the bottle back, I would say that the stuff was absolutely no use at all. My motives were good. I just didn't want people to waste their money. I truly believe that this patient did not need nutritional supplement and could get all the vitamins they need from a good diet. After all, that's what I had learned. In medical school, I could even quote a few research studies that shows the potential danger of some supplements. What I did not share with my patient was that I had not spent a minute evaluating the hundreds of scientific conduct studies that proved the value of nutritional to the health. But what was I to do about my sickly wife? I may be able to pull off professional magic at the office, but at home, I was just another husband looking helpless as his wife waits away. I really had no choice, so I said to Liz, "Go ahead, try the vitamin. What do you have to lose?" Her friend brought a collection of vitamin supplements to our house. The next day, heavy on the antioxidants, nutrition like vitamin E, vitamin C, and beta-carotene that protects the body against the harmful effect of oxidation. Liz eager swallowed them and drank 2 health drinks as well. To my amazing moment, within 3 days, she obviously felt better. I was happy for her, but confused. As subsequently days passed, Liz gained more energy and strength and even stayed up later in the evening. After 3 weeks of faithful swallowing many pills, consuming those strange-looking drinks, Liz feels so good that she stopped taking the steroid and nebulizer and treatment. 3 months passed, all bringing gradually improvements, and Liz never looked back. She was stronger than she had been in years and exuded a renewed outlook on life. I saw the sparkling in her eyes when she returned from training and caring for her horse. She not only could do the work in the horse barn, but also was no longer fearful of suffering from allergic reactions to the haze, mold, and dust. Instead of leaping off to bed shortly after dinner, she was staying up until 11 and 12 at night. I was now the one who had to the bed before many mates. What had happened? I was dumbfounded. If I had not been eyewitnesses to this transformation, I would have never believed it. Was it possible some weird vitamins had restored my wife's health when all the medical experts and medication could not help? Not only had Liz's lungs recovered from the pneumonia, the symptom of her fibromyalgia had improved dramatically. Since there really is no medical treatment for fibromyalgia, what was going on? Was this one of God's mystery miracle, or was it possible that Liz's nearly recovered health was due to those hoary nutritional supplements? For a person trained in the medical science, I did what come naturally. I decided to return my own clinical trial. I called my record to find 5 of my worst fibromyalgia patients and asked them to visit my office. How's that for a twist? A doctor calling a patient to make an appointment. I shared Liz's story with all of them and suggested them consider to taking nutritional supplements. I told each patient that I had no idea whether this alternative treatment would help, but it was worth a try. Typically, fibromyalgia suffering are despondent. So each of my 5 subjects was very eager. After a period of time ranging from 3 to 6 months without expectation, each patient reported improvement after taking the vitamin supplement. Not everyone had dramatically a health rebound as my wife, but all were encouraged and had fresh hope. One of those women's class was particularly severe. She had sought answers at the Mayo Clinic and 2 different pain clinics, but because there really is no effective medical treatment for fibromyalgia, she found no consistent relief. A year's earlier pain had so beaten her down that she had attempted suicide. Now, after taking this nutritional supplement, she called and left a message on my home answering machine. obviously in tears and struggling to speak, she said, "Dr. Strand, thank you for giving my life back to me." Every doctor loved to hear words like that. But just what was happening to this patient? Since I knew that my preliminary studies was 5 patients was not enough to research scientific certainty on nutritional supplement, I need to dig deeper. My research on nutritional supplementation. While browsing through a bookstore a week later, I saw a book by Dr. Kenneth Cooper called The Antioxidants Revolution. Thomas Nelson, 1994. Since I had always admired Dr. Cooper for his experts on aerobic exercise and preventive medicine, I was inquisitive about his opinion on antioxidants. Dr. Cooper explained a process called oxidative stress, which he indicated was the underlying cause of chronic degenerative disease, essentially a who's who of the health problem plaguing humanity today. I devote the book. We all know that oxygen is essential for life itself, yet oxygen is also inherently dangerous to our existence. This is known as the oxygen paradox. Scientific research has established beyond a shadow of doubt that oxidative stress or cells damaged by free radicals is the root cause of more than 70 chronic degenerative disease. The same process that causes iron to rust or a cut apple to turning brown is the underlying interior of disease like coronary artery disease, cancer, strokes, arthritis, multiple sclerosis, Alzheimer's dementia, and macular degeneration. That is right, we are actually rusting on the inside. Every chronic disease I have mentioned is the direct result of toxic effects of oxygen. In fact, oxidative stress is the leading theory behind the aging process itself. In addition to this, our body were under constant attack from an army of pollutions in our air, foods, and water. Our stress-filled lifestyle also take a toll. If we do not counteracting those processes, the result is cell deterioration and ultimately disease. This is why the truths revealed in this book are so critical to our health. Learn about how unheightened oxidative stress damages the bodies, dramatically changed my prospect on chronic degenerative disease. For example, since oxidative stress can actually cause damage to the DNA nucleus of cells, it may be actual villain in cancer. This opens up the tremendous possibility of using antioxidants in cancer prevention. Since oxidative stress also causes arthritis, multiple sclerosis, lupus, macular degeneration, diabetes, Parkinson's disease, and Crohn's disease, nutritional supplements may also combat and control those illnesses. In this book by Dr. Cooper, we opened on some study of patients done at his aerobic center in Dallas Center, the cause of overtraining syndrome. Surprisingly, Dr. Cooper discovered that some athletes who train intensive end up later struggling with serious chronic illness. They are showing significance of having oxidative stress, and the list of symptoms associated with the syndrome were eerily similar to those of fibromyalgia patients. I began to wonder, Could oxidative stress causing fibromyalgia too? Is this why my wife, several of my patients are getting better by taking high-quality antioxidants? This marked the beginning of my investigation in the dark side of oxygen. I was so intrigued by Dr. Cooper's argument that I decided to check out on the research study he had cited. I started a search for everything I could find in mainstream medical literature on oxidative stress. In the past year alone, I have examined more than 1,300 peer-reviewed medical studies involving nutritional supplements and how they affect chronic degenerative disease. These studies were double-blind, placebo-controlled medical study, the kind that physicians love. The overwhelming majority of this study shows significant health benefit to those patients who take nutrition at optimal levels, which are significantly higher than the RDA recommended daily allowance level. Vitamin and you? When you understand the tremendous damage that oxidative stress inflicts during normal daily life on the human body, you realize how important it is to optimize your own natural defense system. Your health and life depend on it. Through my research, I learned that the strongest defense against those diseases in our body are natural antioxidants and immune system. These are far superior to any drugs I can prescribe. I conclude after much study that using nutritional supplement on patients is not alternative medicine, but is instead of complementary medicine. In fact, it may represent the very best in mainline medicine because it is true preventive medicine. Taking nutritional supplement is not about eradicating disease. It is about promoting vibrant health. After reviewing medical research study, I have absolutely no doubt that my patients who take high-quality nutritional supplements have a health benefits over those who don't. Although a patient may have a particular health problem, in recommending nutritional supplements, I'm not necessarily treating that particular disease. I am simply enable the patient to provide the nutrients to his or her body at the optimum level that study have shown to provide to his or her body at optimum level that study have shown to provide a health benefit based on the medical research. This approach to health I have labeled cellular nutrition, which enable the body to do what God's intended. The personal case history that I present in this book are one I have documented in my office. I have changed some name to protect privacy, but many are the story of patients and friends who want to share the exactly detail of their story here with you. Within this story, you will discover real-life example of how the important concepts I present were actually applied. If you are already sick, please be encouraged. Almost all of these true stories are about patients who had lost their health too, which much encourage and determination they continue to seek answers. And after testing the principle presenting here, they regain their health. Liz is my best case study. By the way, her health remained robust. Even though she married a doctor, instead of spending many hours every day in pain and weakness in bed, she now lives in the fulfillment life of her dream. She has the energy to fully enjoy being a wife and mother, and her passion for training and showing horse is no longer just wishful thinking but a daily reality. To learn more about this amazing form of preventive medicine, read on. Thank you for watching. Next chapter, I will reading chapter 2, Living too short, dying too long. Thank you. See you next time.